Real quick update on our mobile screening. As we speak, our team is out at the Boy Scout camp near Walton doing some testing on the setup and so forth. As you can see there from the visuals, what we're doing right now is testing like the IT connectivity, hotspots, and process. And they'll be working through the day with a couple of dry runs. We will be getting you B-roll and stills for the media, and with that we'll include signage that you'll see on the van and some B-rolls of them actually going through the kind of the physical process testing that takes place. We do intend to have labeling on these on the mobile screening unit in both English and Spanish, so it can be readily available to the two primary languages that we find in our communities. Before we have John and Dr. Silenieks come up, we'll get with our daily stats. Our midnight census was at 368 last night. Our Bryan Easy Visit screening questionnaires, that's been out there for, well, a good month plus now, has been completed by 10,253 people, resulting in 3,094 easy visits, and 1,444 have used the COVID promo code. With our numbers, I checked at 10 o'clock this morning, and you guys in the media are always on this stuff, but in Lancaster County, there have been 2,547 people tested with 97 positives. Obviously, that's not all of the positives testing that has occurred in Lancaster County. Some of them are not residents, so you'll see that in Bryan's numbers. We have now tested 2,131. We have 111 positive results, 1,892 negative results, and we have 128 pending. There was a big volume at our drive-through yesterday, and John will provide some additional insight on that. So with that, I'll have John, followed by Dr. Silenieks.
Thanks, Bob. I'm John Woodrich, CEO of Bryan Medical Center. So as Bob mentioned, we had an uptick in our testing, over 130 yesterday, 99 at our drive-through. So we're seeing more of that need increase over time. We have 17 pending patients in-house and 4 that are positive, so you see an uptick in that as well. Only 3 that are on a ventilator, which is good news. And with that, Bob talked about the mobile unit. We're really excited about that and can't wait to service other individuals. With that, I'm going to ask Dr. Silenieks to come forward.
Good morning. I'm Dr. Aina Silenieks. I'm a pathologist, and I'm the medical director of the transfusion service here at Bryan Medical Center. And I'm here today to tell you about a new treatment option for our COVID-19 patients that we now have available. As you know, since the beginning of 2020, the world has been confronted by an outbreak of a new disease, COVID-19. It's spread over a huge geographic area. It's affected millions of people. That's why it gets the dubious distinction of being called a pandemic. The virus that causes this disease has no vaccine, no monoclonal antibodies, no specific drugs available for its treatment because it's brand new. But that does not mean that there is no hope. Convalescent plasma refers to blood plasma collected from people who have recovered from an illness, in this case, COVID-19. This plasma is then used to treat others that are ill with the disease. It's possible that convalescent plasma, which contains antibodies against the virus, could help patients with serious or life-threatening infections. Convalescent plasma has been around for a long time. It's been used to stem outbreaks of viral diseases since the early 20th century, starting with the Spanish flu. More recently, it's been used in the management of patients with SARS, MERS, and even Ebola. The results have been somewhat variable, but mostly favorable. And probably the most important thing is patients have not had significant complications from the use of convalescent plasma. So, in In the last few months, a few very small studies have come out of China about using COVID-19 convalescent plasma, or CCP as we call it, to treat patients ill with the disease. The information in these studies suggests that this treatment may be beneficial, but most importantly, it's also safe. So, in early April of this year, the FDA issued guidance to provide recommendations to healthcare providers and investigators on the administration and study of convalescent plasma collected from individuals who have recovered from COVID-19. Because convalescent plasma has not yet been approved for use by the FDA, it is regulated as an investigational product. The only ways to gain access to this product are through either a clinical trial, an expanded access program, or a single patient emergency investigational new drug application. The good news is that the Mayo Clinic is now a national site for the CCP Expanded Access Program. And I'm very pleased to report that as of April 6th, Bryan Medical Center is a registered participant in this program. There's a multidisciplinary team involved in this project at Bryan Medical Center. It includes infectious disease specialists, pharmacists, laboratory, as well as IT staff. Participation in this study is limited. Adults, at least 19 years of age, confirmed positive COVID-19 testing, who've been admitted to an acute care facility, a hospital basically, with severe or life-threatening COVID-19 disease, or if they're found to be at high risk of progression to severe or life-threatening disease. There's a special and a very specific consent process involved in the use of this treatment because it is still investigational. If a patient decides to participate in the study, the next step is acquiring the CCP. How do we do that? Well, it takes another team. All blood and blood products used at Bryan Medical Center come from the Nebraska Community Blood Bank, or NCBB, which has been serving the patients of Lincoln since 1968. In 2012, NCBB joined with Minnesota-based Memorial Blood Centers, which is another nonprofit community blood center, and they formed Innovative Blood Resources, which continued to provide blood products and specialized services to Lincoln and this region. Importantly, in 2016, Innovative Blood Resources announced a strategic partnership with New York Blood Center Enterprises. This dramatically expanded clinical capabilities, access to special products, and provided additional organizational services and expertise that has benefited patients in Lincoln. And you'll notice that the New York Blood Center includes Community Blood Center of Kansas City, the Blood Bank of Delmarva, which is in Delaware, and the Rhode Island Blood Center. So, when the time came and eligible patients at Bryan Medical Center decided to participate in this CCP study, we turned to NCBB and its partners to find the product that we needed. It took less than a day for us to receive the plasma that was needed for our patients. All of the plasma used so far has come from the New York Blood Center. We have treated a small number of patients and plan to continue to identify patients who meet the study criteria and offer them the option of convalescent plasma. However, there are two very important things to keep in mind. Convalescent plasma is a product with limited availability. Availability relies completely on the goodness and generosity of people who have recovered from COVID-19 disease, being willing to take the time and make the effort to donate their plasma. The second important thing is to remember that there are no guarantees. And I'd like to quote Dr. Jed Gorland from IBR, who said, "There is a very modest clinical experience published from small case series in China, suggesting that if administered sufficiently early, less than 10 days into the illness, there may be some benefit. The New York Blood Center was the first to collect convalescent plasma, and that began at the end of March. Collection has now started in Kansas City as well as in Minneapolis. Nebraska Community Blood Bank hopes to begin collecting donations in May. Information on that process is available on their website, which is ncbb.org. It involves completing an online questionnaire and then consultation with a staff member at NCBB before making an appointment for a donation. While it's still too early in the process to know with certainty what effect this plasma will have on patients with COVID-19 disease, all of us involved in the study are dedicated to doing our part to finding the best treatment options for our patients. Thank you.
So if the cleaning is diligent from the volunteers at polling stations, if they're donning and doffing their protective gear properly, yes, these things should help on polling day. I think it would be important for voters to stay 6 feet away from others when they're in line or when the workers are collecting and gathering the ballots. And I think what we would say from Bryan is to encourage those in person to also wear a mask. Masking, as we know, is more important in helping prevent the spread of it, but it will also provide some protection from some tiny droplets that could be lingering in the air. So please wear your mask when you go to vote. Poll workers and volunteers, be as diligent as you possibly can in keeping things clean and people separated. And then, I don't know, I think I might even bring my own pencil. Touching things unnecessarily would be quite important there.
When I said small, I did mean small. We have treated 3 patients so far. It's all been within the last week or so. As far as how these patients have done, that's a complicated answer. They're typically people that are very sick, have more than one thing going on, and so it's really hard to tell, especially this early in the process, because it can take a week or so sometimes for the full effect of the plasma to be seen. So I'm sorry, it's a vague answer, but I think it's the best we can do at this point. The study runs for a year, so it will be a while before we have written hard data in journal articles and that sort of thing, but I suspect we may get some hints down the road a few months.
So our understanding right now is when the National Guard comes to Crete that they're going to administer about 100 tests. We've been watching that area and feel that we need to offer additional assistance, and that's why we'll bring that mobile unit to the Crete area hospital first. And what we want to do is just give people the availability for testing. I think people have seen, as they've looked across Nebraska and actually across the country, there is a high concern for specific plants. And I know these plants are essential in providing food, but we're seeing some numbers that are raising concern with us, and that's why we want to go to that Crete location to really make ourselves available. Let's do the appropriate testing. Let's help educate folks. Let's make sure that we're not having a language barrier come into play. We're working with our health department to help provide translators as well. We're working with the health department over that area, and we're just trying to avoid another hot spot occurring in the state of Nebraska. So we will be working in conjunction with them if they prefer in that, but we also just want to be there because we're watching our numbers. And right now what we're seeing happen in that area is starting to raise alarm with us, so that's why we're going to make that mobile unit available. You know, all the modeling that we've done, especially in Lancaster County, we're looking for that surge to hit its peak around the first part of May. When we're looking at the Crete area, until we go down there and do more testing, I think it's really hard to determine that. But we're seeing more positives come from that area, and that's what's raising alarm for us. And we just want to make sure that we're there to help people, and that's our whole goal behind this. We have seen some positive patients at Crete that ended up being transferred to Bryan Medical Center. As long as we have the capacity to take care of those individuals, we're seeing more transfers come in from outside of our county. As we've stated in the past, we're going to support those critical access hospitals in those rural communities the best that we can. And if we ever reach that level that we can't, we'll figure out a way of having the less intense or patients that we can have stay in those locations, and we'll try to take care of those more severely ill individuals. Yeah, I don't know the exact number, but our doors have been open, and we're accepting patients from all over the state. So, you know, we've seen them as far as Grand Island and Hastings and Valentine, and you could just name locations, but it's just our network that we've always set up, and I've had a long-term relationship with all the hospitals across Nebraska.